As daratumumab moves into the frontline setting, I think it would be important to recognize the right kind of patients. Think about patients who are receiving a doublet regimen where you want to add a third agent, which does not add a lot of side effects or competing side effects to that regimen. So utilizing a data-based frontline regimen for that kind of a patient, or someone who has existing neuropathy where you're thinking adding a proteasome inhibitor would actually aggravate the side effects, that particular issue with a given patient. And then looking at the convenience factor as well. Not every patient can come in for an infusion. So thinking about the convenience factor for patients as well as you're deciding the right treatment. Monoclonal antibodies, for the most part, if you're thinking about infusion-related reactions, they tend to happen with daratumumab for the during the first cycle. So that's probably the cycle where you need to pay a little bit more attention to it, specifically with the first one. But it doesn't happen in every patient. Maybe 3 out of 10 patients will experience some degree of infusion-related reactions during that first cycle. The other important thing to note as you're managing these patients is pre-existing pulmonary conditions to make sure that their COPD or asthma is well controlled. You would consider a monoclonal antibody for that kind of a patient. And then you have to sit down and talk to your patient about all these options and help them in picking out the best particular option for them. So we are in an exciting time, for myeloma patients. The survival for myeloma patients has almost quadrupled in the past 2 decades. Now we're starting to incorporate monoclonal antibodies into the frontline setting. I think this makes our job as oncologists a little challenging on how best to sequence therapies, but that's a good problem to have. I think, with the growing number of regimens we have for each setting, we're going to start seeing algorithms that are patient-specific. There was a time when I started in the field, we only had 1 or 2 options. Now we have several options, 7 different mechanisms of actions working together to get patients to the best depth of response and survival outcomes. So, overall, I'm very hopeful for all myeloma patients.